Hello, my name is Ian Greger, and this is my presentation on the promotion of athletic training. And so, what is athletic training? Athletic training, a relatively newer field of profession, deals with the prevention, rehabilitation, assessment, and treatment of athletes. As part of the sports medicine team, an athletic trainer's job is to respond to injuries that occur during time of play and use preventative techniques such as taping, conditioning methods to help minimize the risk of an injury occurring. The goal of athletic trainers is to help athletes return to play in a safe and quick manner and to lead the athletes through what could be a difficult time for them throughout their process of returning to play. Rehabilitation is a critical process that athletic trainers must go through with their athletes to help them be able to return to play. And this process starts with a proper evaluation and a diagnosis provided for the mechanism of injury. And two different types of injuries can be assessed, which that being acute, which is a single occurrence that can lead to a injury, and a chronic injury is something that is a overuse part of a specific body and can gradually increase the injury over time. And depending on the severity of the injury, exercise can be beneficial to helping reduce the time of play for athletes. However, the initial goal is to help control pain and inflammation prior to anything else. And the job of an athletic trainer is to develop a plan of rehab for their athletes. This can include a wide range of different ways that athletic trainers utilize to help their athletes return to play, and these plans usually are sport specific and will target a specific part of the body that has been put under stress or has been hurt and injured in part of play. And so these plans are often developed for what sport the athlete plays and should be specific to it. For instance, if you are working with a hockey player and they come in and they have a lateral ankle sprain, we would want to regain strength in that ankle. So you could develop a plan that includes resistive training to help strengthen the ligaments in that ankle. And once being able to return to play, taping is done further to stabilize that area to help prevent further re-injuring that same ankle. So athletic trainers have a lot of preventative techniques that they use with their athletes to help them with their rehabilitation process and help them to quickly return to play. And so some of these techniques include rest, which is important for not using any muscles, so it can help start that inflammation process within the body. Taping and wraps for helping stabilize body parts, and it helps limit range of motion, which can be beneficial for, say, if you have an ankle sprain, you want to keep the integrity of that ankle straight and not have any movement that is unnecessary with that. Furthermore, we have stretching and rolling, which can help minimize the chance for muscle tears by improving blood circulation, and can also limit cramping. Icing, which is important for reducing swelling and inflammation, and proper body mechanics teaching as well. So if you see poor technique in any athletes while they are doing their sport, or if they are trying out new things with their rehab process and you see bad form, you should correct that to not lead to further damage anywhere else in their body. And lastly, fluid intake is important for helping with muscle cramping, or to help prevent muscle cramping and to allow the body to function normally. So as athletic trainers, we may see some of the most gruesome and rather could result in career-ending injuries for players. And so our jobs is to respond with the knowledge that we know, and to care for these athletes accordingly, and and our goal is to ultimately try to get them to return to play with the same confidence as they once had.